Okay, okay, sure, sure. Good evening to all IFPH members. It's 1942 day of uninterrupted daily webinar of IFPH, 25 December 2025. And this is the English session. I'm Dr. Rachita Tripathi. I have done my BHMS from Dr. B.R. Sir Homeopathic Medical College. And right now I am practicing classical homeopathy at Wellness Clinic Sector 36 RWA Community Center, Noida. Okay, and previously I have presented fever topic, uh, and this is the second part of my topic, and I am sharing the slides. These are my slides. Now, first of all, we have medicines for acute cases, for acute fever. In acute cases, as we know that aconitum napellus, the first remedy in our mind, that is, it's common in monks or family Ranunculaceae. Aconite has sudden, acute, violent invasion, and the fright is the most characteristic manifestation of aconite. And the ailments come from overheating and over chilling of the body. Patient always feels chilliness if uncovered or touched. Mentally, the patient is so restless, anxious, and even he has fear of death, predicts the day. If there is a clock in the room, he predicts the time, fears the future. Aconite causes only functional disturbance. Okay, there is no pathological change, and we can't prescribe for the pathological changes. And it is useful in catheter fever too. Okay, now this is aconite flower, and according to the doctrine of signature, look the color of the flower. These are so purplish. So as the patient. Patient is plethoric and the symptoms are intense, like the color of the flower. So intensified, sudden, fear, fever, chill. Okay, this is the beauty of the doctrine of nature. Next, sleeplessness. In patient, there is sleeplessness, restlessness, tossing about. Patient is restless and patient feel better in open air. Always, although he is chilly, but he wants open air. Okay, wards in warm room, evening and night. Then wards affected side from music and from tobacco smoke, cold wind, relationship, wine, coffee, laminate, acid fruit. Not indicated in malarial and low fever, where there is eruptive fever. There is eruption, pathological change comes, we can't prescribe aconite. And aconite is acute, then sulfur is chronic. Complementary to cophia in fever, sleeplessness, intolerance of pain. Complementary to arnica. Now, aconite follows arnica in traumatism, like mechanical injuries cases, rarely indicating fevers which bring out eruption, like low fever, malarial fever, where there is eruption, we can't prescribe aconite. Then ferrum phos, that is phosphate of iron. In the early cases, these are the acute medicines. In early cases of febrile condition, ferrum phos comes in between aconite and belladonna, but the sluggishness, torpidity of gelsemium in paraphos there is less sluggishness, and paraphos is not fully blooded robust, but nervousness, anemic, and false plethora, and easy flushing of param, prostration marked. Okay, but there is no anxiety like aconite. Aconite patient is anxious about the disease. There is a reason of fright. There is a patient who developed fright since COVID. So she says every time I got fever, I remember the days of COVID. So in aconite, there is anxiety, restlessness. Ailment comes after fright. The remedy for the first stage of all febrile disturbances, inflammation before agitation sets in. Phenymphosph 3x used for increased hemoglobin, and for subacute laryngitis with fossils inflamed, red, we can give Phenymphosph 2x. Okay. And in fever, chill daily at 1 p.m. Okay. Next, belladonna. Belladonna, as the name suggests, deadly nightshade. The patient looks red, hot, and the cheeks are red, and the fever is high. There is no thirst in belladonna. Although he has dry mouth and dry throat, but there is no thirst, a high feverish state with comparative absence of toxemia, burning, pungent, steaming, hot, no thirst. Now in arnica, leopard vein, arnica patient mentally, patient in delirium, tossing at night. He can't feel bed soft. He roams around the home in search of soft spots, and patient is unconscious. When we ask something from patient, he answers correctly, but then suddenly goes to unconsciousness. And patient always says there is nothing with him. Okay. And in fever, there is sore, lame, bruised feeling. Head, uh, head is hot. Head, there is heat and redness of the head with coolness of the lower body. Upper body is hot and lower body is cold. That is the peculiarity in arnica for fever cases. Then belladonna and arnica plant. Now, look the belladonna plant. Okay, there are dark berries and bell-shaped flowers. As we look a patient for belladonna, the appearance is dark, glossy, redness, flushed skin. Okay, then look the arnica flowers are so yellow, gloomy, and sunny. So arnica is used in cases for healing purposes. Now, arsenicum album. Arsenic patient is exhausted and anxious, fearful, and he has fear and restlessness, unquenchable thirst. Okay, changes place continually, mentally and physically. Both have restlessness. Think it useless to take medicine and high temperature, periodicity marked with adynemia, then paroxysm incomplete with marked exhaustion. Then comes gelsemium, yellow jasmine. Gelsemium patient looks distorted. There are three Ds: dizziness, drowsiness, and dullness. Patient looks as if dizziness, drowsiness, distorted, drunkard, trembling, and there is slow pulse during fever, muscular weakness, more muscular weakness. Ailment come from general heat of sun, bad effects from fright, fear, exciting news. Then heat and sweat state is long, exhausting. Then comes Gelsemium plant. Gelsemium plant is yellow in color. So according to the doctrine of signature, the patient looks yellow skin as in jaundice. Okay, so we can think gelsemium in cases for jaundice. Now, Brinia and Restock. Brinia, that is white briny, wild hog. Patient is robust, irritable, black haired, and dark complexion, and dry. There is dryness all over, dry, parched lips, mouth, excessive thirst, bitter taste in mouth, sensitive epigastrium, pulse full, hard, tense, and quick. Then there are ailments coming from overheat and after sweating, and easy profuse perspiration, rheumatic and typhoid marked by gastrohepatic complications. Then Restalk, that is poison ivy. In Restalk patients, the restlessness is physically. Okay, patient always move and walk and feels better by change of position. There is great apprehension at night. Patient cannot remain in bed. He moves here and there. Okay, in fever and typhoid cases, the tongue looks dry and brown, throat and bowels loose, great restlessness. Then look the Brynia plant. Brynia plant looks white, yellow. Okay, so as the patient in Brynia, the patient is robust, fleshy, bitter, yellowish, white root. So in patient there is acrid discharge and the tongue looks white, yellowish, like the petals of the flower. Now this is the Restock plant. Okay, in Restock plant, if someone touch this plant, it creates itching and vesicles in the skin. Okay, now the constitutional remedies for the fever. Natramute, that is chloride of sodium, prolonged taking of excessive salt causes profound nutritive changes to take place in the system. Patients complain uh, of anemia, chlorosis. Okay, if we go into the history, patient tells about that he desired for salt. So there is prolonged taking of excessive salt and a great remedy for certain form of intermittent fever, anemia, chlorosis, many disturbances of alimentary tract and skin, great debility, most weakness felt in the morning. Natramute patient aggravated by consolation. If someone says, console him for his her emotions, for his her problems, then patient get aggravated. But if we compare Natramure with Pulse, Pulse wants consolation. Okay, then in fever cases, Natramure chill between 9 a.m. and 11 a.m. Heat violent, thirst increase with fever. If we compare with Pulse, Pulse is thirstless, and there is changeability in Pulse. One time chill, then another time there is heat and there is change in mood in Pulse. Okay. Then in Natrimute there is continuous irritability, coldness of the body and continuous chilliness very marked. Hydramia in chronic malaria states with weakness, constipation, loss of appetite, sweats on every exertion. Now comes CPR. CPR is a constitutional remedy. Common name Inky juice. CPR patient look is like dark hair, rigid fiber. Patient is mild, easy, like pulse, but she is indifferentiated. Okay, she doesn't want to do anything. She's indolent, weak, yellow complexion, wearing down sensation, ailment after period of lactation, and CPS is also called washerwoman's remedy, especially in women. Okay, feels cold every time, even in warm rooms she feels chilly. Indifferentiate to those love best. Headache during menstrual period with a scanty flow. Always feeling of goodness, not relieved by eating. If we compare with lyco patient also feel goodness feeling, especially in morning. But Lyco get better by eating, but sepia never relieved by eating. Nausea in morning before eating. Okay, long now sepia likes vinegar, acid, pickles, wars after milk, especially boiled milk. Last time I have presented a case of fever and I have prescribed sepia because of the peculiar symptom, warts after milk, especially when boiled. Okay, so in sepia there is warts after milk, especially when boiled, and there is also one more symptom, nausea in morning before eating, goneness feeling. And the patient also looks like sepia, yellow complexion and weak and sluggish, longing for vinegar acid, shivering with thirst, general lack of heat. Patient is very chilly, always feel chilly, even in warm weather, summer. She wants covering. Now pulsatilla. Pulsatilla, common name wind flower, the weathercock among remedies. Now, why this name said to be weathercock among remedies? Because pulsatilla has a tendency to change. Her symptom always changing. No two chill alike, no two stools alike, and even the mood always changes. One time she is laughing, another time she is weeping. Okay, so the name comes from here, the weathercock among remedies. It is preeminently a female remedy, especially for mild, gentle, yielding disposition. Patient is mild, yielding disposition, and patient C wants open air. She feels better in open air. In closed room, she feels suffocated. She wants to go outside, even though she is chilly. Okay, discharges thick, bland, yellowish green, often indicated after abuse of iron tonic. Okay, and in badly managed measles, thirstless. Okay, pulsatilla is thirstless, and pivot chili like sympathy, wants consolation. The children like first care, want someone console them, whereas morbid dread of opposite sex. In Pulse, she has dread of opposite sex. Okay. Dry mouth without thirst. Patient having dry mouth, but there is no thirst. Wants it washed frequently. Want to wash the dry mouth frequently. Crack in middle of lower lip. We, if a patient comes like this, having dry mouth without thirst, and if you observe there is prick in middle of lower lip. We can ask more about her nature. If she found to be mild, gentle, weeping disposition, then we can think of pulse in cases of chronic fever as a constitutional medicine. Yellow or white tongue. Now this is pulsatilla plant. Okay. Pulsatilla grows in desert, and in desert, pulsatilla plant needs less water. Like this, the patient doesn't have the feeling of want to have water. He needs less water and having dry mouth. Now, miasmatic remedies in cases of fever, sulfur, as aconite is the acute, so sulfur is the chronic. Okay, sulfur often follows in acute diseases. Sulfur is a great Hahnemannian antisoric, and standing is the ward position. As we all know, sulfur is the lazy patient, and he thinks rags beautiful. If the patient wear torn clothes, he feels good. These are beautiful things for him. He has different delusion, immensely well-being. Okay, and aversion to business, low. He is very lazy. And in fever, there is flashes of heat, violent ebullition of heat throughout entire body. There is dry skin, dirty skin, itching, vesicles, great thirst, night sweat on knee, and also there is burning in different parts. Okay, the discharges are burning, perspiration of single part, disgusting sweat, and he wants to be uncovered during night because of burning sensation. Remittent type. Remittent type of fever. Fever always fluctuate. In what is remittent type of fever? Fever always fluctuate, never comes to normal or baseline. Example, typhoid. Now tuberculinum. Tuberculinum, a nucleoprotein, a notodes from tubercular abscess. Now tuberculinum patient adapted to light complexion people, narrow chested subjects, patient always tired, motion causes intense fatigue, aversion to work. Tuberculosis patient also want changes, and symptoms are also constantly changing. Well selected remedies fail to improve And tuberculum patient catches cold easily from slightest exposure. Diarrhea in children running for weeks, extreme fasting, bluish, pallor, exhaustion, mentally deficient children, tonsils enlarged. Now, tuberculum patients have fear of dogs, animals especially. Patient desire to use foul language, curse, swear, and aversion to meat. Tuberculinum diathesis. Okay, aversion to meat. All gone, hungry sensation, desire for cold milk. In post-critical temperature of a remittent type, we can prescribe tuberculinum, repeat dose every 2 hours, profuse sweat, general chilliness, then profuse sweat, general chilliness, what, motion, music, before a storm, standing, dampness from drought, early morning and after sleep, better open air. Now, tuberculinum needs more frequent repetition in children's complaint than nearly every other chronic remedy. 30 and much higher in infrequent doses. When tuberculinum fails, triple often follows advantageously produces a reaction. Okay, next types of fever. Now, bilious fever, fever associated with vomiting of bile, gastric irritation, liver-related symptoms. In bilious fever, we can think baptisia, that is wild indigo. Baptisia patients have distorted look, drunken look, okay, often asthenic type, simulating low fever, septic condition of the blood, indescribable sick feeling. There is great muscular soreness, putrid phenomena. The discharges of baptisia are offensive, breath offensive, stool offensive, urine offensive, sweat offensive, and baptisia in low dilution produces a form of antibodies to the bacteria typhosus. Okay, that is the agglutinin. Now, baptisia raises the natural bodily resistance to the invasion of the bacillary intoxication, which produces the typhoid syndrome, typhoid carrier. Then mental general, patient have many delusions like broken, double, tosses about the bed, trying to get pieces together. And there is unconsciousness in the mid of the answer. When we ask something to baptisia patient, uh, he suddenly gets half asleep. Then early deafness in typhoid condition, face distorted look, teeth and gums sore, ulcerated, breath fitted, tongue feels burned, and can swallow liquids only, leave solid food gag. And then baptisia in gastric fever. In gastric fever, there is desire for water and stool are offensive as uh, I have told earlier that discharges are offensive. There is thin, dark, bloody. Stools are thin, dark, bloody, and offensive. Sleepless and restless, falls asleep while answering a question. The Tisha patient goes asleep in the mid of the answer. If we compare it from Arnika complete the answer, then goes in delirium. But in baptisia, the patient goes in the mid of the answer. The patient go to sleep or unconscious in the mid of the answer. Baptisia look is distorted. If you see Arnika patient, Arnika says there is nothing to him and unconsciousness and tosses and delirium at night. Okay. Then chill with rheumatic pains and soreness all over body in baptisia. Then chill about 11 a.m. Baptisia for typhus fever, shipboard fever. Okay, commonly seen in crowded ships among sailors, migrants, soldiers, and shipboard fever is caused by Rickettsia prowazekii. It is a body lice, it's spread by body lice. Modality war, humid heat. Now, baptisia aggravated by humid heat and fog and indoors. Then purpuratum, as the name suggests, bone set. There is all over bone pain in limbs, muscles, and so we can think in fever like malaria, influenza, chikungunya, are post-operative pains. Okay, post-joint pains in malaria cases, influenza, and chikungunya. Okay. And Eupatorium acts principally upon the gastrohepatic organs, bronchial mucous membrane, and it is born in miasmatic district. Then mouth cracks in corners of mouth, yellow coated tongue in Eupatorium purpuratum, thirst, vomiting and purging of bile, green liquid, several quarts at a time. Then hotness and cough, soreness in chest. Perspiration relieves all symptoms of Eupatorium purpuratum except headache. Okay, headache can't relieve by perspiration. Chill between 7 and 9 a.m. preceded by thirst with great soreness and aching of bones, nausea, vomiting of bile at close of chill or hot stage, throbbing headache. No chill is coming on because he cannot drink enough. Okay, so before thirst there is chill. Modalities was periodically better by conversation. Patient feel better while conversation by getting on hands and knees. Patient feel better. Then last time we talk about Mediterranean fever. Okay, Mediterranean fever is a hereditary type of fever and commonly seen in Mediterranean descent, and it is due to a mutation in MEFV gene located on chromosome 16. There is defective pyrin that leads to uncontrolled inflammation. Okay, that leads to recurrent attack of fever, and it is mainly found in Mediterranean descent. Okay, now in homeopathy there is a remedy called chicum, mesosaffron. There is always great prostration, internal coldness, tendency to collapse, and bad effects from suppressed sweat. In J.H. Clark, Materia Medica, pupils widely dilated, face, tearing pains in face, throat, increased secretion of saliva, stomach on rising from bed at night, nausea suddenly increased and was followed by vomiting of undigested food and afterward of a bitter greenish fluid. Stools accompanied with tenesmus and consisting of a thin fluid with numerous flakes looking like the cooked white of egg in pieces from 2 to 4 inches long. Then remittent fever. For remittent fever, there is R cells, Cenium sulfuricum, and Cinna, Gelsemium, Epicox. Cinna Cinna is a great children's remedy. Its child looks like big, fat, rosy, scrofulous, and irritability of temper, variable appetite, grinding of teeth, and even convulsions with screams and violent jerking of hand and feet, all within its range. Child is very cross, ugly, doesn't want to be touched or crossed or carried, itching of nose all the time. Child always want to rub, pick the nose, bore the nose till it bleeds. His stool looks white, like small pieces of popcorn, preceded by pinching colic. Now in fever, there is light chill, much fever associated with clean tongue. When our tongue is clean, okay? Much hunger, colicky pain, chilliness with thirst, cold sweat on forehead, nose, and hands. In Sina, fever, face is cold, hands are warm. In Sina, if we prescribe for fever, face is cold and hands are warm. If we compare from Arnica, upper body is hot and lower body is cool. And in Sina, face is cold and hands are warm. Then come medicine according to heat in different parts. Okay. Febrile heat ascends from pelvic organs. If patient feels febrile heat ascend from pelvic organs, then the remedy is CPR. Febrile heat in whole body, face red hot, patient is chilly from least motion or uncovering. Then the remedy is Nux vomica. Febrile heat with hot face, back chilly, feet cold. Face is hot, back chilly, feet cold, then pulse. Febrile heat with red spot on the left cheek, that is acetic acidum. And then febrile heat with restless sleep, calcarea calm. Febrile heat with colic, veratrum album. Afternoon fever with glowing heat in face, hands, feet. Copious sweat on upper part of body, that is eza diarrhea indica, that is neem. Okay, and remedies according to the fever specific. For dengue fever, there is Restock, Eupatorium perculatum, Aconite, Gelsemium, Measles, Gelsemium. For measles, there is Euphrasia, Gelsemium, Calibi, Sticta, and for varicella, Entimtar, Restock, Muxol. Septic fever, there are Arsenicum album, Pyrogenum, urethral fever, Chininum arsenicosum, Gelsemium. Now, vegetable kingdom. The remedies from vegetable kingdom have short-acting remedies. Are short-acting remedies like aconite, belladonna, Gelsemium. These remedies are from vegetable kingdom, and they have short-acting remedies, and they have good result for acute cases. Okay. In chronic cases, medicine prepared from no source, mineral kingdom, many drug of animal kingdom are deep acting remedies. Okay. It is important to check the fundamental function of body working properly or not. If we prescribe medicine from vegetable group, we have to look for excretory function. If we prescribe from animal kingdom, heart and kidney should be normal. If we prescribe from mineral group, a local lesion is not grave. Then uh, from vegetable kingdom, how we start a treatment from vegetable kingdom, then metal given in later part. Results are better. According to aphorism number 272, as Hahnemann said, single simple medicinal substance at one time. Okay. And these globules, when placed dry on the tongue, it is the smallest dose that is sufficient to cure a case. But few nerves are touched by the medicine. A similar globule crushed with some sugar of milk and dissolved in good deal of water. Tasted well before every administration will produce a far more powerful medicine for the use of several days. Okay, so medicine in a single globule with some water, with some deal of water, with stirred nicely, uh, have a powerful action on the patient. Okay, now drug administration. We can administer it by oral route when patient is in good functioning well. But if patient can't move like comatose stage or vegetative stage, then we can give through olfaction method and by application to the skin like rubbing, friction, okay, and others eye and ear. Now, selection of potency. As we know, there is low potency below 30, medium 30 to 1 m, high above 1 m. What is the criteria for selection of potency? That is susceptibility. Okay. Now, how we assess susceptibility? If a physician has knowledge of allied subject, unbiased experience, freedom from prejudice, attention in observing, and he knows about the fundamental principle of homeopathy. Okay, then he can assess the susceptibility of a patient. Higher the susceptibility, higher the potency. Lower the susceptibility, lower the potency. Now, what are the factors to assume the susceptibility of a patient? Age. If patient is a child, children have high susceptibilities. Okay, young adults, they require higher potency as children. Okay, because there is no wear and tear of organs, there is growing stage. So they have high susceptibility, they need high potency. In old age, as there is wear and tear, susceptibility become low. So they require low and medium potency. Now, in male and female, female who are mild, quiet in nature, sluggish, they need low or medium potency. Males who are irritable, sensitive nature, have a higher susceptibility, require higher potency. Then higher potencies are best selected, like a person engaged in highly intellectual and mental work, like doctor, lawyers, minister. Those who are highly intellectual, we give high potency. Sedentary occupations, excitement of imagination and emotions. Okay, long sleep and effeminate life. Means to say that who are living luxurious life. So in those cases, we give high potency. Then lower potencies are best adapted to those engaged in physical labor without much mental exertion. Those who are doing physical labor much, but there is no mental exertion. Okay, no intellectual workout. Who sleep little, whose food is cold, person exposed to the continual influence of drugs such as tobacco workers, dealers, distillers, and brewers, and all connected with the liquor and tobacco trade, druggists, perfumers, chemical workers, then idiots, imbeciles, and the deaf and the dumb. Those who are sluggish, weak in mind, okay, imbeciles, uh, those mean lower potency. Then constitution and temperament. Sensitive persons, often nervous, sanguine, and choleric temperament, intellectual persons, quick to act and react, they need higher potency. Okay, those persons who are intellectual, sanguine, choleric, nervous, sensitive, they need higher potency. For potency. Torpid and phlegmatic individual, dull of comprehension, slow to act, they need low potency. Low potency but repeated at long intervals. Oversensitive patient, idiosyncratic patient. In idiosyncratic patient, we have to prescribe lower potency. Okay, because they prove every medicine. And repetition should be in long intervals. Now, nature and depth of the disease. In acute disease, naturally susceptibility of the patient remains higher. Moreover, sudden onset, rapid progress, and more or less fixed duration of disease indicate higher susceptibility in acute cases as the onset is sudden. Okay, so there is higher susceptibility, rapid progress, like acute diseases, chickenpox, measles, influenza, whooping cough, meningitis, common cold. In acute cases, potency should be higher, and repeated doses of higher potencies are effective to arrest the progress of the disease in acute cases. Okay, in acute cases with lowered vitality, in acute cases with high susceptibility, as patient needs high potency. Okay, like common cold, chicken pox, measles. But in those conditions where there is low vitality, like diarrhea, vomiting, dehydration, shock, collapse, Where there is lowered vitality, patient needs low potencies in repeated doses to overcome the inhibitory state of vital dynamics. Then in chronic diseases, without gross organic changes, if there is no gross organic changes, means to say that like hypertension, if there is no arteriosclerosis, okay, and in diabetes mellitus, if the kidney is good, heart is good, then we can prescribe higher potencies as curative if given in single or repeated doses, like migraine, neuralgia, neurosis. Okay, with gross organic changes, but if there are changes, gross organic changes, like affection of kidney, heart, okay, then the susceptibility becomes low. So, because of long continued suffering and organic changes. So, there we have to prescribe low or medium potencies. In mental diseases, susceptibility is high, but we can't prescribe high potencies because the aggravation is so violent. Uh, so, we have to give low or medium potency. Okay, now for difficult and incurable cases, 50 millesimal potencies are good. Now, according to the seat of the disease, where an important organ involved, an internal organ has been considerably deteriorated, or there is deteriorating organs, okay, like softening of brain, and there are changes in kidney, heart. So there we have to prescribe material doses of the medicine. Like in ischemic heart diseases, we have to give cactus tincture, spongia tincture, and the previous treatment of the disease. Patients who have taken many fluid drugs, homeopathic or allopathic, many fluid medicine, there we have to prescribe higher potency. Now, according to the stage of the disease. Now, according to the stage of the disease process manifested in two stages. Okay, dynamic pathology. Dynamic pathology denotes the stage from the very beginning of the disease till structural changes start. Okay, now dynamic pathology when there is no structural change. During this period, susceptibility is high, so we have to give high potency in single dose, no frequent repetition. Organic pathology if there is beginning of structural changes. Okay, then we have then the susceptibility goes down. So we have to prescribe low potency. Okay. Then for primary manifestation of SORA, psychosis, and syphilis require high potency. Primary manifestation of SORA, psychosis, syphilis require high potency, and secondary manifestation of SORA, psychosis, syphilis require low potency. Then the nature of medicine. According to the nature of medicine, no source. Okay, no source, the medicine prepared from disease secretion like sorinum, medurinum, tuberculinum, verulinum. The medicine should be administered in higher potencies. No source should be given in higher potency. Okay, great care must be taken in selection of potency of deep acting remedies in serious chronic cases. Okay, then examples like be careful of using lycopodium in potencies much higher than 12C in case of severe pain like duodenal ulcer or may precipitate a perforation. This is according to H.W. Boyd. It is dangerous to give phosphorus in high potencies to patients with advanced phthisis as it may start a hemorrhage that may prove fatal according to Emil Tyler. Now, phosphorus, silesia, lachesis are these three very dangerous remedies if there is pre-tubercular history. The wrong potency or too frequent repetition may drive the patient to active tuberculosis. Okay, now this is ended. If anyone have any question, they can ask.
Yes, very nice presentation. And
Thanks.
at the same time, we must reflect a lot of practical points in the system because we know the total number of patients in the hospital, around 10 to 20% patients are affected with fever.
Yes,
And
sir.
with a simple disease, often we witness a lot of complications because of
Right.
the management, the wrong management of the condition. In
Hmm.
such situation, homeopathy is very, very effective in such cases. So it is up to the physician as well as the patient to
Hmm.
utilize the possibilities of this great system. And everybody is conversant about the individualized management and the personalized medicine. We can see the only one possibility is homeopathy because
Yes, sir.
no other systems of medicine has this much of medicine, number of medicines in case treating a fever case. We
Hmm.
have a dozen medicine at least, but we have hundreds of medicines.
Yes,
So
sir.
it is up to the physician, but at the same time, very difficult to select the right medicine. That's the most important thing.
Yes, sir.
You can close your screen share. Okay. The time for discussion. Those who would like to participate, please raise your hand. Dr. Tanesh, are you there? I think he's not responding. So you rightly mentioned about the medicine, the role of these anti-asthmatic medicines and deep-acting medicines.
Yes, sir.
That is very, very important in cases treating such cases.
Hmm.
Especially in the acute cases, it often indicates the constitution of the patient, the
Hmm.
chronic disease, the chronic medicine of the patient. If you
Yes.
carefully observe, that will provide you enough clue that will further prevent certain other acute disease as well as chronic disease.
Yes, sir.
What is it,
Right.
Dr. Rajita? What is your insight in that statement, opinion?
Sir, actually, these days now, patients just run after allopathic treatment for low fever, viral fever. So, in these cases, homeopathy works so beautifully that for viral fevers, we can prescribe homeopathically. Okay, and as we have so many medicines, aconite, belladonna, like this. So, patient have to be patient with homeopathy.
Then often what happens is that the attenuation is very important. The
Mm.
medicine dose, potency, everything is okay, but if it is unnecessarily dissolved in water, that will produce aggravation, definitely.
Yes, sir.
Another point is that often as a routine practice, taking water along with medicine, it often complicates the case. So the most
Yes.
ideal method, the physician should be very careful about that. He should
Hmm.
have a logical as well as philosophical approach to the case. Otherwise, these type of errors often happening and will end in deteriorating the case. And homeopathy is unnecessarily blind by some persons because of the
Yes.
wrong judgment of the physician. So
Hmm.
advise the patient not to take water along the medicine. Then it is always better to give the medicine dry upon tongue, not in dissolved water. So that is why I think in the aforementioned 17 right animal mentions the medicine, dose, potency, and attenuation. The four conditions are there. Not only
Hmm.
medicines, not only potency, not dose, but the attenuation also is very important. So that be
Yes.
very much very cautious about that thing.
Okay. Thank you, sir.
Then again, in sense case, the cold water sponging often happens in case of the children. What
Hmm.
happens? The doctors advise that will reduce the temperature. That will never reduce the temperature at the same. Sometimes it will often lead into pneumonia conditions. And
Yes,
then
sir.
again,
Sometimes.
then another thing is that then the general management often depends upon the medicine you prescribe.
Hmm. Hmm.
That's
Hmm.
another
Hmm.
thing. So a
Hmm.
lot of conditions is needed. A careful approach is needed in treating while treating homeopathic patient homeopathically. Dr. Tanesh is back again. Dr. Tanesh, you can
Yes,
conclude.
Dr. Rachita Tripathi, it was really a very good session.
Thank you.
We
Thank you so much.
most of the doctors used to struggle a little bit in the treatment of fever because they, when you begin, when you start a clinic, you will get different type of patients and
Hmm.
children,
Right.
particularly children. But
Hmm.
identifying each and every children is an art. But finding, differentiating, that is the differential diagnosis of each medicine is required to identify, and that too in a short time, because we when you become a very eminent practitioner, you will get a lot of acute cases as well as chronic cases.
Hmm.
And
Hmm.
then you may have a little time, only you may have only little time to take each and every case. In those conditions, knowing the patient is what we require, because when a patient enters into the clinic itself, you can identify and find what medicine to be given to the patient, even without looking the temperature, even asking what happened to the child. By observation alone, we can prescribe, because
Right.
it's
Right.
particularly we can see a person who is coming into the clinic and doing lot of disturbance to others and doing this and that, and jumping up and down and like that, and playing like dancing, and sometimes maybe quarreling. All these things can different we can differentiate a different medicine. And
Okay.
for example, at times we may have to give belladonna for a child. At times it may be stramonium, it may be
Hmm. Hmm. Hmm.
pulsatilla.
According
But
to
what?
the constitution and
Yes,
appearance of the
yes, yes, yes. For
patient.
example,
Yes, Dr. Tanesh, you have to start the next
if,
session. Dr. Tanesh, please conclude.
yes,
I think some network
if,
problem.
if
Dr. Tanesh.
people congratulations for coming out here. Some problem I couldn't join inside, and that's the reason why I was a little bit of starting to spend this time. Anyway, as it's also while I'm having from the very beginning. And once again, on behalf